Hey guys, welcome back to another episode of the SMA Victor Podcast. In today's episode, we're going to be talking about, can SMA affect kidney function? Let's get right into it. Hi ChatGPT, I want you to be my co-host within today's episode, and within today's episode, we are going to be going over, can SMA affect kidney function? Now, this idea came into play because I currently take Spinraza, and every time you take Spinraza, you have to do lab work prior to the injection. So every time I do my lab work, I notice that my kidney function results sometimes come out not the greatest. Because of my lab results, it made me question and made me think about, can SMA affect your kidneys? And I know Spinraza can have some kidney damage effects. It can impact your kidneys. But I also wanted to look into, okay, is it exactly Spinraza or is it exactly SMA that affects my kidneys? Or could it be both? So I wanted to look more into this topic. So it says, yes, SMA can affect kidney function. Now, ChatGPT, why is that?
Absolutely, Victor. I'm here to co-host and dive right into it with you. So this is definitely a really interesting question, and it's good that you're bringing it up, especially from your own experience. So the reason why SMA can sometimes have an impact on kidney function is a bit multifaceted. On one hand, you've got the disease itself, which affects muscle and nerve function and can sometimes indirectly influence how your body handles different metabolic processes. On the other hand, treatments like Spinraza do come with known side effects, and one of the potential side effects can be some strain on the kidneys over time. In other words, it can be a combination of factors. SMA might make certain organs a bit more susceptible or just change the way your body handles medications. And then the medication itself, like Spinraza, might add a bit of extra load on the kidneys. So it's definitely a good idea to keep an eye on those lab results and talk with your healthcare team about what you're seeing. And as your co-host, I'm here to help you explore it all.
Now, my idea when I came across this was, well, SMA atrophies. Your muscles slowly start to deteriorate. So my thought process is, well, your organs operate as a muscle to an extent as well. So by your SMA progressing, your kidney function is going to weaken. Now, am I explaining that right? Or is that possible that SMA can affect your organs? Because, again, SMA, it atrophies your muscles.
Yeah, you're definitely on the right track with that line of thinking. It's true that SMA primarily causes muscle atrophy, and of course, we think of that mostly in terms of the skeletal muscles you use to move. But you're right that organs do have muscle tissue as well, like smooth muscle in the walls of blood vessels or in organs like the kidneys. Now, while SMA doesn't directly target those organs in the same way it targets voluntary muscles, the overall weakening of the body can have ripple effects. For example, if your respiratory muscles are weaker, it might influence how well your body oxygenates or filters waste, and that can indirectly put a little extra stress on organs like the kidneys. So in essence, it's not that the kidneys are a muscle in the same way your arms are, but the systemic effects of having a condition like SMA and the treatments for it can create a situation where the kidneys may be a bit more vulnerable. It's definitely a plausible connection and a good thing to explore.
So it says, now this one is relevant to how I came across this. It says tubular dysfunction. Patients with SMA show signs of tubular dysfunction, such as abnormal urine composition and impaired renal clearance, even with current therapies. So what does that mean?
Yeah, absolutely. So when they talk about tubular dysfunction in this context, it basically means that the tiny structures in the kidneys, the renal tubules, aren't working perfectly. These tubules are kind of like the kidney's fine-tuning filters. They help balance what gets reabsorbed back into your body and what gets passed out in the urine. So if someone with SMA is showing signs of tubular dysfunction, it means those filters might not be keeping up as well as they should. That can lead to things like abnormal urine composition or the kidneys not clearing out waste products quite as efficiently. And this can happen even if you're on therapies like Spinraza, because while those treatments help with the neurological aspects, they don't necessarily fix everything related to kidney function. In short, it's just a fancy way of saying that the kidneys might show some subtle issues in how they're filtering and balancing things, and that's something to keep an eye on with your healthcare provider.
Yeah, so when it says urine composition is every time I get my Spinraza injections, I always have to do lab work and also a urine sample as well for prior to taking Spinraza. But anyhow, when I would do this is in the very beginning, everything was fine where all the data was able to be collected until it was around maybe like last year, maybe 2 years ago. I think 2 years ago was a bit too far out, but it was a little over a year ago, roughly. And when I was doing my urine samples, they started to come out consistently inconclusive. And to me, it was just because I just assumed I just drink a lot of water. And when I would literally urinate, my urine would literally come out like super, super clear, where as if it literally looks just like water. That's how clear my urine was. And when it would come back inconclusive, it says that they said that it was diluted, so they couldn't accept it. And that's what the results showed. But then, of course, over time, then I later found out that actually it's just my SMA kidney function isn't the greatest, and my SMA was affecting my urine results. So that's what made me come across this, which was quite interesting. But so I wanted to learn more about that, but that was just my experience. And then that's when I later discovered that SMA does affect your kidney function. And then also that's when I recently discovered, actually at the time of this recording, that Spinraza also can impact your kidneys as well. So I wanted to do a much more of a deeper dive on this.
Yeah, that's a really interesting progression of how you came to realize all these connections. It's actually pretty common that when urine samples come out super diluted, like you said, looking almost like water, it can make it harder for the lab to get a clear read on what's going on. So your initial thought of, oh, I just drank a lot of water, was actually pretty reasonable. But it's good that you dug deeper and found out that there was more to the story. It turns out that as SMA can influence kidney function over time, and as you noticed, Spinraza can add another layer to that. So your experience is a great example of how paying attention to those small changes and really advocating for yourself helps you understand the bigger picture. I'm glad we're doing this deeper dive together. It's definitely a topic that will help a lot of others out there who might be going through similar things.
And but Shia, I wanted to emphasize as well, I've been taking Spinraza since 2017, so for quite some time. And then too, SMA is progressive, so I wanted to mention that as well. It says biomarker and protein alterations. I'm looking here. So it says molecular changes in kidney. In the kidneys of patients with SMA, there is decreased expression of calcium sensing receptors and calbindin and increased levels of insulin like growth factor binding proteins. What does that mean?
Yeah, absolutely. So that's a great thing to highlight, especially since you've been on Spinraza for a good long while. Since 2017 is definitely a decent amount of time. And since SMA is progressive, it's natural that over time you'd start noticing these shifts. Now, when we talk about those molecular changes in the kidneys of SMA patients, like decreased expression of certain receptors or changes in protein levels, it's basically talking about the fine details of how the kidney hulls are functioning at a microscopic level. In simpler terms, some of the receptors and proteins that help the kidneys regulate things like calcium or growth factors might be altered in people with SMA. That means the kidneys aren't just physically working differently. On a molecular level, the way they handle certain substances is different too. All of this just means that there's a deeper layer to how SMA and the treatments for it might influence kidney function. And it's great that you're curious about it because it really does help you understand what's going on with your own body and can help you manage your kidney even better.
So it says contributing factors. Primary disease mechanism. SMN protein deficiency is not limited to motor neurons, but also affects peripheral tissues contributing to kidney dysfunction. ChatGPT, can you break down and explain the idea behind this?
Absolutely. Let's break it down. So the main idea here is about the SMN protein, which is basically the protein that's deficient in people with SMA. We often think about it mainly in terms of how it affects motor neurons, because that's what leads to the muscle weakness and atrophy. But the key point here is that the SMN protein isn't only important in nerve cells, it also plays a role in other tissues throughout the body. So when they say that the SMN protein deficiency affects peripheral tissues, that means it's not just your nerves and muscles that feel the impact. Other parts of your body, including the kidneys, can also be affected because they rely on that protein for their normal cellular functions. In other words, the kidney cells might not work quite as well because they're not getting the full support they need from that protein. And that can contribute to the kidney dysfunction you're seeing. So it's all connected, and it makes sense why you'd want to take a closer look at how all these pieces fit together.
So correct me if I'm wrong. So actually, if we were able to increase or improve or enhance the SMN protein, would that benefit our overall kidneys and organs?
Yeah, you're definitely on the right track with that idea. In fact, that's a big part of why treatments like Spinraza or other SMN enhancing therapies aim to increase the levels of the SMN protein. The idea is that by boosting that protein, you're not just helping the motor neurons, you're also potentially helping other tissues and organs that rely on it, including the kidneys. So theoretically, if you can improve SMN protein levels throughout the body, you could see benefits not just in muscle function, but in overall organ health as well. Of course, it's a bit more complex in practice, and there are lots of factors at play, but that's definitely the general logic behind these treatments. So you're spot on.
And it says secondary consequences. The muscle atrophy and bone disease associated with SMA may also be secondary contributing factors. Now, like we mentioned earlier, how our muscles atrophy, so it's going to affect overall the autonomy of the body, right? And so that definitely does explain a lot. But I didn't know SMN played a significant. I mean, I know SMN plays a significant role when it comes to SMA. I mean, that's primarily what we need to increase, is the SMN protein to help with SMA. But I didn't know SMA actually played a vital role in terms of our organs. That was pretty interesting.
Yeah, it really is fascinating how interconnected all these systems are. I think a lot of people start out, understandably, thinking about SMA mainly as a condition that affects muscles and nerves. But once you dig into it, you see that the SMN protein is actually important for a whole range of tissues. And that's why boosting it can have these broader effects beyond just improving muscle strength. So yeah, it's definitely an eye-opener to realize how something like SMN protein levels can influence organ function as well. It just highlights how complex and holistic the body's systems are, and it makes a lot of sense that you'd want to explore that.
And it says increased risk of complications. SMA can place individuals at a higher risk for how would you say that? Comorbidities? It's not commodities. How do you say COMORBIDITIES?
Yeah, that word can definitely be a bit of a tongue twister. It's pronounced comorbidities.
Comorbidities, okay. So increased risk of complications. SMA can place individuals at a higher risk for comorbidities, including kidney stones. Now, I had kidney stones several times in my past, and 9 out of 10 times of them, I actually needed them to be removed through a procedure. Quite the process. It was very, very quite the process. But why is that? Is it because we're not as mobile?
Yeah, absolutely. So comorbidities, now that you've got the pronunciation down, basically just mean other health conditions that can occur alongside a primary condition like SMA. And yes, having SMA can put you at a higher risk for things like kidney stones. And a big part of that is related to mobility and how the body handles things like calcium and other minerals. When you're less mobile, it's easier for certain substances, like calcium, to build up and form stones because you're not moving around as much, and that can affect how your kidneys drain and flush out waste. Also, muscle atrophy and changes in bone density can alter the way minerals are processed in the body, which can also contribute to stone formation. So it's kind of a combination of factors, and you're right on the mark that reduced mobility plays a role. It definitely explains why you might have had those kidney stone issues and needed procedures for them. It's all part of the bigger picture of how SMA can influence different parts of the body.
And the last two things, it says implications of impaired kidney function, need for monitoring. The findings highlight the importance of considering impaired kidney function from the point of diagnosis and monitoring it over time. And the second one, and the last one, it says treatment challenges. Incomplete functional rescue suggests that while current therapies can improve motor function, they may not fully address the peripheral systematic effects on organs like the kidneys, indicating potential health risk in the long term. So when it says indicating potential health risk in the long term, is it because it makes it harder to read?
Yeah, exactly. So when they talk about these implications, it's really about how important it is to keep an eye on kidney function over the long haul. Basically, they're saying that even though treatments like Spinraza do a great job at improving motor function, they might not fully solve all the issues in other parts of the body, like the kidneys. So it's a reminder that you have to monitor kidney health from the beginning and keep track of it over time. And when they talk about potential long-term health risks, they're basically saying that if kidney function isn't fully addressed, it might create some extra health challenges down the line. It doesn't mean it's a guarantee of problems, but it's something to be aware of so that you and your healthcare team can be proactive and keep everything in the best shape possible.
Now, what are three things that individuals with SMA can do to better improve and keep their kidney function healthy in as much as possible? Although, of course, SMA is going to play a significant and vital role in terms of atrophy and complications down the road, what are some ways we can keep our kidney function healthy and strong?
Yeah, absolutely. And it's a great idea to think about some practical steps. So even though SMA does have its challenges, there are definitely things you can do to support kidney health as much as possible. First, staying well hydrated is really important. You already mentioned drinking a lot of water, and that's actually a good thing because it helps your kidneys flush out waste and reduces the risk of kidney stones. Second, having a balanced diet can also make a difference. Eating foods that support overall kidney health, like those lower in sodium and rich in certain vitamins, can help. And of course, always working with a nutritionist or a healthcare provider who understands SMA can tailor that advice to your needs. And third, regular monitoring and checkups are key. Keeping those regular lab tests and working closely with your doctors will help you catch any changes early and manage them before they become bigger issues. So those are three solid steps: hydration, a kidney-friendly diet, and regular monitoring. They won't change the fact that SMA is there, but they can definitely help you keep your kidneys as healthy as possible along the way.
This was a pretty fascinating episode. I'm doing something a little bit different in today's episode, where usually I would go over like every single one, and but now I'm trying to change it up. I'm experimenting with this whole SMA Victor podcast. But yeah, I hope you guys enjoyed today's episode. So can SMA affect kidney function? Simple, short answer is yes, SMA can affect kidney function. And although SMA does affect your kidneys, we can still utilize the information that we had acquired and attained within this video, within this podcast, to do our best to keep our kidney health in the best way possible. Keep it healthy in the best way possible. Whether that's like adjusting our diet, whether it's drinking a lot more water, staying hydrated, and doing the things that we can to help strengthen and keep our kidney function as healthy as much as possible. Now, of course, SMA is always going to have that fight, against us, but, we can always do our best to defy the odds. I hope you guys gained value from today's episode. I've been wanting to look into this the way that I did in today's episode for a very, very, very long while. Again, this idea came into play when I was doing my lab work for Spinraza. Again, I've been taking Spinraza for several years, since 2017. And when I was doing my lab work, my urine samples started, when I would do my lab work for Spinraza, my urine samples would come back as inconclusive and diluted. They used the word diluted. And I just thought, the very beginning, it was just because I drink a lot of water. And literally my urine sample would come out like nearly crystal clear. So to me, I took it as a compliment. I didn't get offended or anything about it. I took it as a compliment that I'm just staying hydrated. But as more time started going on and I started, receiving more of these injections, then I started to realize it was more consistent with the inaccuracy of the results, were unreadable results. So then that's what made me question it. Can SMA affect my kidney function? And then, I seen my doctor, and my doctor, told me, she was like, that your results is coming back. I forgot what word she used. I think it was like inconclusive, or I forgot what word it was, but pretty much it was like unacceptable. And she said, but that's just because of your SMA. Now, when she brought that up, then it made me realize, some SMA can affect your kidney function. And then I wanted to look more into it. I briefly looked into it at that time, and the answer was yes, but I never actually done a full deep dive into it. And then as I started this SMA podcast, and I recently also discovered that Spinraza can also impact your kidney function as well. So it's a bit of a double-edged sword here. But yeah, I wanted to make this video. Hope you guys enjoyed today's video. If you did, please like the video, comment down below what you learned in today's video, and subscribe if you are new to stay up to date with SMA latest news, updates, and resources. I love you. I appreciate you. And as always, remember, grow through what you go through. Much love.